The episode that helped us decide I should move to the rest home was really bad, and when I went to the Oaks, they had to put shackles on me and chain me, and it wasn't me at all.
A young woman with a college degree and a bright future is overcome, not by her own choice, instead by her own mind. Cara is a victim of mental illness. While she fights to get better, Cara's parents fight on her behalf, so Cara and thousands of others don't get lost in the state system. We're digging into Cara's case in this WECT News special report. Getting around these days is not easy for Cara. The broken ankle, it's just an inconvenience. What you can't see is the 24/7 struggle she has with her own mind.
The thoughts just take over your mind, and sometimes you can barely move. Things just kind of get all bubbly, like you have make-believe friends in your head. And you think sometimes they're friendly voices and sometimes they're scary voices.
Cara says the voices started around the age of 15.
But she managed it. She went to college, got a degree.
But a breakdown in 1999 led to the diagnosis. Cara is a paranoid schizophrenic.
I've been homicidal before, and that's scary, and I was in a mental institution in Wilmington for it. But I'm able to function with those kind of thoughts and delusions and suicidal tendencies. I'm just starting to learn to deal with it, because you can't beat it, but you can cope with it.
Cara remembers being restrained once in a mental hospital, and she has struggled with drugs. The medications intended to help can also hurt.
The medications are poison, absolute poison. They're necessary poison, but they're absolute poisons to the brain. So not surprisingly to psychiatrists and others, and probably to us, is her situation has declined.
Cara became a danger to herself and others. Stan and Kitty had to put their daughter in the care of experts. For the past 2.5 years, Cara has lived in an adult care home where she finally feels safe again.
Sometimes I listen to music or knit. I'm still trying to fill my time.
Right.
Because as I improve, I have a lot of time on my hands.
Right.
But I know I'm in a good, safe place, so I want to stay there. But just little things like that that don't come easy to me anymore.
Cara has been happy where she is, and to see that that might not be where she gets to stay, well, it's devastating. It's heartbreaking.
A couple of years ago, the feds threatened to sue North Carolina over the way the state handles mental health patients. The settlement brought some changes to the rules. Under the new rules, Cara no longer qualifies for the same level of service or the same amount of Medicaid funding. Well, that funding paid for about half of the costs of where she lives right now.
Of course, that 40% is going to be tough on the nursing home to continue to support housing for those people affected, including our daughter.
The Oathouts are appealing Cara's case, hoping to keep her services as they are until the state's new plan begins July 1st. The goal of the plan is to transition patients like Cara into more independent living. So a long-term goal would be to live on your own again?
Yeah, maybe. I'm not sure.
Right.
I don't think I'm the best judge of that right now, because I get scared that my hair is going to shake when I cook.
And it's just gotta hurt.
And it does.
It does.
And we
even times you think, I can't do it another day, and then she's too precious.
Sometimes it's hard to talk about it, and sometimes it's easy.
Yeah.
And we just started becoming a family about 2 years ago. They always loved me, and I always loved them, but now we're learning how to communicate with each other better.
Cara's case is under appeal. Her parents hope that a mediator will overturn the recent assessment of her situation and keep her services as they are right now, because without that, they fear Cara could actually take a step backwards, or even worse, maybe not feel so safe again. That could bring on more problems. And lawmakers are deciding on funding for adult care homes. That could get a final vote in Raleigh later on this week.